My name is Joyce Bowton, and I'd like to start first by saying I'm a cancer survivor. It hasn't always been that way. At one time, I was very ill with cancer. Back in 1992, I was diagnosed with breast cancer, and it had metastasized to the lymph nodes. And the choice of treatment at that time was either a mastectomy or a lumpectomy. And it was somewhat difficult to get the lumpectomy approved, which I did go for. And then I was told that I had to go into, or was offered the option of going into a clinical trial at that time, which I did. And in this trial, I received quadruple doses of chemotherapy for 4.5 months, was on adriamycin and Cytoxan. And following that, I had 7 weeks of radiation. And after that was all over, they told me that I had about an 80% chance of reoccurrence within 1 year in spite of that treatment. And knowing that, I was pretty devastated. And so it actually what I began to do was a search of trying to find alternative approaches or other means of treatment because I wasn't satisfied with that prognosis. And being an RN and having been an RN for many years and taught nursing, it was difficult for me to step out of that framework of Western medicine to start looking at other options. And it was through a friend of mine, actually through a friend of my husband, that we actually found this clinic. My husband contacted this person because he knew he'd had cancer and had a story to tell, and he hadn't talked to him in years. And so when he talked to him, he'd heard his remarkable story, and so they talked us into going out to dinner with him. And I don't remember anything I ate at that meal because I was so enthralled with what I had heard. And so when we finished, and with much encouragement from my husband, then we decided to seek out this clinic. And so in October of that year, this is where I came. It's difficult because you're getting all these different conflicting reports from the medical establishment telling you that these are things that are not approved, and they're probably something that's going to drain your pocketbook and not going to help you much. But I think a person with cancer who educates themselves somewhat and is really, really wanting to fight to live, they'll find other resources. And this one, fortunately, was the one that I chose. And living in San Diego, of course, I'm close to a lot of clinics in Mexico, and I've heard a lot of things about those clinics as well. And I've met patients here that have attended those, but they end up here. And so I can't say enough good things about what has happened here for me anyway, and for a lot of other people that I've seen. But I think you need to get educated to determine what's best for you and to begin to ask the right questions. And anything you do is a leap of faith. So you have to believe that you're going in the right direction, and you also have to think about quality of life. And a lot of the Western medicine treatments are such that leave patients so debilitated that they don't have quality of life even in the remaining amount of time that they have. And but it was a hard decision, and I know a lot of my friends, a lot of my peers, a lot of my medical friends were very disapproving of what I did, and then initially. And now, of course, seeing where I'm at, they always say to me, well, if I have someone who has cancer in my family, I'd like them to talk to you and at least check out this clinic and see what is being offered. And now I've been a patient here. This is my 18th year, and I've had no other treatment, and I've had no reoccurrence of breast cancer during that time. I feel myself being very fortunate, but I find that the only thing that I've done differently has been this treatment, and I do credit that to the fact that I'm here today.